This week on Diabetes Connections, we're exploring an approach to diabetes care that's not just about providing treatment, but also about understanding the impact of giving. Unbound is leading a unique study to see if generosity and connection can improve health outcomes for both the donor and the recipient. I'm talking to Dan Pearson, Chief International Program Officer, about the study, who they're looking for, and what they hope to learn. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Hello and welcome to another week of the show. I am always so glad to have you here. You know we aim to educate and inspire about diabetes with a focus on people who use insulin. I'm your host, Stacey Sims, just back from Mom's Night Out Atlanta, our first Mom's Night Out event of 2025. So excited to kick this off. Thank you to everyone who made it such a fun time. To all the people I finally met in person after talking to you online for a long time. Lots of fun photos and more information on our social media, of course. And our next city is coming up very quickly. February 21st, we will be in Cleveland. Lots of fun stuff planned for that stop. And we will be in Minneapolis and in Phoenix this fall. I am already getting requests for cities in 2026. So we're doing our best. I wish we could do one every week in a different city. Maybe we'll figure that out someday in the future. But thanks again to everybody who came to Atlanta. It was a great time. Quick follow-up on last week's episode. I had featured Rhonda. She's the mom of a young adult with type 1 diabetes and Down syndrome. And we talked about finding a community. She has a type 1 mom community, but didn't know any other families that had that dual diagnosis. I was so thrilled to hear from other moms who wanted to connect with Rhonda, who have children with type 1 and Down syndrome. We're in the process of connecting everybody. And Breakthrough T1D is launching a virtual event this month, open to any parent or caregiver of a child with a dual diagnosis of type 1 and neurodivergence, which includes Down syndrome. So I'm going to link up more information in the show notes. I've already put it on social media. But you can find it at diabetes-connections.com and then click on this episode's homepage. And that neurodivergence covers a lot of different diagnoses, so please check that out. But thank you, Breakthrough T1D, Northern California chapter, for reaching out and letting me know so I could help spread the word. This is the best community. And if you don't know anybody else in diabetes, I'm stuttering because it's hard to describe how much it helped us over the years. I mean, that is why the show is called Diabetes Connections. That's why I do Mom's Night Out events. This is everything to me. So if you are struggling, please reach out. Let us know. Diabetes is such an isolating condition, and finding other people who know what you're going through makes a big difference. It has been proven. It leads to better health outcomes. And that kind of leads us to this week's guest. All right, so here's the question. Can community, connection, and generosity result in better health? So this is a new study, and they're looking to answer this question, particularly the generosity part. I'm talking to Dan Pearson. He's the Chief International Program Officer for Unbound. They do a lot of things, much more, as you'll hear, than this particular study. And they are looking to improve the health of diabetes patients in the Philippines who are living in poverty. The study they are hoping to launch is very different. It includes a charitable component for the person in the U.S. who's taking part. This is open to people with all types of diabetes, type 1, type 2, gestational. So please share this episode for those who may not always listen, because this show is geared for people who use insulin. But this study is open to everybody with diabetes. And my conversation with Dan is coming up right after this. One of the things we love the most about the Dexcom G6 is that it helped Benny become more independent, but maybe not in the way you're thinking. I mean, remote monitoring using the Dexcom Share and Follow let us be more confident letting him do more away from home with friends or at camp. But just the design change of G6 meant Benny could use one hand to insert the sensor. He was 14. He didn't want our help anymore. It was perfect timing. Dexcom G7 is even more simple to use and gives effortless diabetes management that fits into your lifestyle without the disruptions. Ease of use helps everybody, and I'm grateful the Dexcom product designers kept that in mind with G7. Learn more, go to diabetes-connections.com and click on the Dexcom logo. Daniel, welcome to Diabetes Connections. I am really excited to learn more about this. Appreciate you spending some time with me. Thanks for being here.
Thank you. It's great to be here.
Tell me a little bit first about the organization. What's the idea here?
Well, we've been walking with families and helping them build their own paths out of poverty all around the world for a little over 40 years. We believe in a very decentralized approach. We believe that families themselves have most of the solutions to the problems that they face, and they just need some accompaniment and organization to accomplish their own goals. And through that, we've discovered that diabetes is a growing problem all around the world.
What is your position? Tell me a little bit more about what you do.
Sure. I'm the Chief International Program Officer. So I'm in charge of sort of weaving together all of the programs around the world.
Where around the world are you? We're going to focus on one program, but do you mind giving us a bigger overview?
Yeah, we have programs in 17 countries in Latin America, Sub-Saharan Africa, and Asia. And we're working with about 250,000 families.
Wow. All right. So tell me a little bit more about how you found that diabetes was impacting these families, because we know that around the world, people don't have access to the same care. Is that what you're talking about?
Yeah, what we found is that when we would visit the homes of the families that we serve, when I travel about 10 times a year to the locations where we have programs, and anytime I travel, I do random home visits to see how the program is experienced through the eyes of the families that we serve. And started noticing more and more situations where our anti-poverty work was really being slowed or stopped or reversed by non-communicable diseases like hypertension, but particularly by diabetes, where families were making progress, but suddenly dad had serious health complications because of his diabetes and lost his job. And so we started digging into the numbers a lot, found that, as you mentioned, diabetes is growing rapidly all around the world, but currently 3 out of 4 of the people in the world who are living with diabetes are living in low and middle income countries. So it's the majority of people living with diabetes. And as you said, the care is very limited. In the case of this pilot in the Philippines, the patients coming into the program didn't have access to A1C. Most of them had very basic or little information about their disease. And about half of the people who have diabetes in low and middle income countries don't even know that they have it. It's never been diagnosed. In fact, when we got started, the program has some health community workers, and one of them, through the sort of practice testing of A1Cs and stuff like that, discovered that he had diabetes and he didn't even know it. So it's that common that anywhere you look, you're seeing people who have the diseases, but they don't know it. And the health systems are not set up for non-communicable diseases. The health systems in these countries have historically been focused on transmittable diseases like malaria, like HIV.
Yeah.
And those are still big problems. But more and more non-communicable diseases like diabetes are becoming more and more prevalent, and the health systems are just not prepared.
Right. And we're talking about both type 1 and type 2.
That's right. Yeah.
Okay.
And the type 2 is increasing as people move to the cities, change their diets, they're less mobile, and their physical activity changes as they move to the city. So a lot of the things that we've experienced in the US now are being experienced in many other countries all around the world.
Yeah. I was just reading a study too that posits that it's air pollution as well is contributing to type 2 diabetes. And that's really interesting when you talk about moving to cities.
Yeah, there are so many complications of this mass migration to cities that we've seen all around the world that we just really aren't prepared for. So we're learning as we go.
Yeah. So tell me about what you're trying to do in the Philippines.
What we're trying to do, because there is such a huge gap in the service, the needs compared to the services that are provided, we're trying to figure out a low-cost model, an affordable model of healthcare for people living with diabetes. And we've partnered with an organization called Chronic Care International, who had a really successful model in the Dominican Republic. And so we took that model and tried to see, does it work in the Philippines also? Completely different context. And we found that it does. Over 90% of the patients in the program are managing their diabetes, whereas coming into the program, it was about 10%. So we can do this. And so we're trying to develop these effective models that we can scale up and offer to other organizations and governments that they're going to be looking to in the future.
Can you tell us a little bit about that? Because from 10% to 90% is a pretty cool leap.
Yeah, there are 4 primary components. One is providing just the basic testing and medicines that were not available to the patients before this program. So we're importing some medicines and some donations and things like that. The A1C was not available to them. So this is the first time they've had A1C testing. So that's one component. The second component is the health education. So they're coming into the doctor's office, the clinic, which is out in the community about once a month. And each time they come, they're getting health education messages about their diabetes, very little information coming into the program. So this is really important. The third component is peer support. So the patients are organized into small groups and they're supporting each other, make the lifestyle changes that they need to make and through their journey with diabetes. And then the fourth component is community support, because we're working with older adults and they are, most of them in the Philippines, living with their children, their adult children. And it's their adult children who are preparing their meals and sort of the caregivers in their lives. And so they need to understand what's happening too and the changes that we need to make in order to keep these older adults healthy.
All right. And so now there's a program stateside that you're hoping that listeners will take part in. Can you tell me a little bit more about that?
That's right. So building on the success that we've had in the Philippines, we started seeing in the research on diabetes that a couple of elements have been found to be effective in helping people manage their diabetes. And those two elements are generosity and social connection. Our organization is a sponsorship organization where we match one donor in the US who sends a monthly donation that goes to their sponsored friend overseas. We're the only major sponsorship organization that works with older adults. So that's another huge demographic trend that we're seeing in the world, is this explosion of the older adult population. Most people don't know that this is how fast this is happening all around the world and in low and middle income countries. It's the fastest growing demographic population, and we're not prepared for that either.
Mm-hmm.
These are set up for kids and to some extent women, but they're not set up for older adults. So we wanted to use this research about generosity and social connection and see if we match a donor, a sponsor in the US with one of these patients, we know that we'll have a positive health impact on the patient. But what about the donor? If the donor has diabetes, does the act of giving and supporting this friend overseas give them the social connection with someone who's dealing with similar challenges, but in a much more difficult context, and the generosity of supporting them, does that improve their health? So we partnered also with the University of North Carolina, and they're running the research part of this to measure the health outcomes for the sponsors in the US.
When I put this in the Diabetes Connections Facebook group, I phrased it as, this is a study, but it's also a charity ask.
Yes.
Is that appropriate to put it that way?
Absolutely. And like so many things that we've as a society come to understand more about mental health, what we're discovering over and over in so many places is that doing something for someone else is good for me also. And it helps my own mental health. It can help my own physical health. And so we want to learn more about that and see, can giving to others improve your health as a sponsor?
How much is it for someone to help out?
Yeah, it's $40 a month is the donation amount. Over 90% of our income goes to support programs. So we're sort of the cost-effective bridge between you and another person. And it makes this global explosion of diabetes more human. It puts a face to it so that you are going to be in contact with someone overseas, one of these patients who is also dealing with similar struggles, achieving similar successes, and they'll write to you. They'll send videos. You can write to them to form a relationship of support that also can help your own health outcomes.
Yeah. Okay. Don't be mad at me for asking this question. People with diabetes in the United States pay a lot of money for health care. $40 a month doesn't sound like a lot, but everything adds up, as you know. There's going to be some people who are going to look at this and say, I would love to take part in this study. Why are they asking individuals when there's corporations and insurance companies and lots of other people who have a lot of money? I know you're tracking the generosity for part of the study, but are you getting the funding from other places? And I guess I should ask you to answer that first question first, though, about the individuals giving.
Yeah. So you're right that in many research studies, the person doing the surveys or whatever it might be, they might get a gift card or something like that. So they're actually receiving something. In this case, it's a little different because we're studying generosity. So we have to have that act of generosity to make it work. It is true that, as you said, people in the US with diabetes face a lot of health costs and other costs to manage their diabetes. And so this isn't for everyone, but we feel like there are some people out there who would like to give this a try and know that they're improving the health outcomes of someone else in the Philippines, but also someone who wants to see, could this be good for me also? And so we are seeking funding in other places, foundations and places like that. So we do want to scale this up in a lot of different ways. But to me, one of the most exciting aspects of this is, can we transform the way that we think about philanthropy and giving, that I'm not just helping someone else. This experience of social connection and reaching out to someone else is also going to help me physically, mentally, emotionally, spiritually, in so many different ways. And that's what we're excited about studying.
Who's eligible for the study? People with all types of diabetes, particular, take us through it. Right back to our conversation. But first, Diabetes Connections is brought to you by Omnipod. It used to be that you would have to choose between an automated insulin delivery system and the freedom of a tubeless device. Now, with Omnipod 5, you can have the best of both worlds all in one. Omnipod 5 adapts with every pod change to meet your unique insulin needs and adjusts insulin using a customized target glucose, not a range. If you're ready to ditch the multiple daily injections or send your tubed pump packing, there's never been a better time. They'll even check your insurance coverage for you. Fill out the quick online form, see if you're eligible for a free trial. Go to diabetes-connections.com and click on the Omnipod logo. For full safety risk information and free trial terms and conditions, visit omnipod.com/diabetesconnections.
Yeah, anyone with type 1, type 2, any sort of diabetes is fine. And we just ask that the person who is writing the letters and kind of developing this relationship be the person with diabetes. It's a very low lift in terms of the research aspect. We'll have a handful of phone calls, probably 2 or 3 phone calls over the course of a year from the team at University of North Carolina, where they'll ask you a few questions about how your health is doing, things like that. And then they may follow up with an online survey. So very little time commitment. It's mostly just, are you interested in exploring the possibility of helping someone else and helping yourself at the same time?
Right. To your knowledge, has anybody looked at this yet?
No, just the research that we've seen in other places, but it wasn't in this sort of sponsorship or donor relationship. It was more in volunteering, community service, and things like that. So this is really new area of research. And that's part of also why it's so exciting. We really want to transform the way people think about philanthropy.
How did you get involved in all this, Daniel? What's your passion here?
My passion is the families that we're serving. And I mentioned that we're the only large sponsorship organization that serves older adults. That's a passion of mine, gerontology. And this is a huge need among the families that we serve. I really believe in these families. These older adults are really sources of such enormous wisdom. And as we see the older adult population grow, later this century, there will be more people in the world over 60 than under 18. And yet there are so few services and programs for people over 60. But this is a huge opportunity. We get better at doing things through practicing, right? Older adults have lived longer, so they have the experience of how to live well. And so they can teach us so much if we see them as a resource and a gift rather than as a burden on society. And staying healthy is an important element of that.
Can you tell us anything about individuals that you've worked with in the Philippines that have benefited from this? Like you mentioned those crazy statistics from 10 to 90%, but like any individuals that stand out to you?
Yeah, I've met older adults in the Philippines over the years. I was there just about 3 months ago doing some planning, some program planning. And one of the beautiful aspects there is that the older adults are directly involved in planning these programs, the diabetes program, but also the other services for older adults. And what I saw, there was a woman there who wanted to express to me how important this was to her to be a part of. And she gave me a pen, just a simple fountain pen that she had, because that's all she has to give. But her whole life, she had experienced frustration because she knows she has gifts and potential, but she's never had a chance to use those to help her community. And so our approach of radically decentralizing development, putting it in the hands of the families, has positive outcomes, not just in the impact of the program, but in the dignity of the person to develop their own paths out of poverty and demonstrate to the world how much they're capable of doing.
My understanding about this study, though, is you have a kind of a quota to fill. Like you have to meet a goal or it doesn't happen at all, which is a little bit unusual for some of this stuff. Do you mind taking us through what you need?
Yeah, we need at least 100 people to step forward and join as sponsors. That's so that this research can have some validity. So we really can tell, does helping someone else help your own health? So we need 100 people to take that challenge on and embrace someone overseas who's having a similar challenge in life.
Wow. I hope we can help. We will link up all of the information We'll put it out there. You can just go to the website and the show notes, and we'll have all of the information for you on how to take part and how to learn more. Daniel, thank you so much for joining me and explaining all this. I really appreciate it. Best of luck with all this. And then come back and tell us how it went.
Absolutely. Absolutely. Thank you so much for having us on.
More information about Unbound and the study and what they're looking for and how you can sign up, you can go to diabetes-connections.com, click on this episode's homepage, or look in the show notes on whatever podcast app you may be listening to. And while you're on those apps, if you have a second, please leave a rating or preferably a review for this show. Every once in a while, I get a not so nice review, and that happened recently on Apple Podcasts. It happens, but if you want to go check that out, feel free. And then please write a nicer one. It's not that easy to leave reviews on Apple, but I always appreciate when folks do that. But, wherever you listen is fine. Thanks as always to my editor, John Buchanan from Audio Editing Solutions. And thank you so much for listening. I'm Stacey Sims. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.